It's time once again for the open enrollment period of the Affordable Care Act plans. That's both on and off exchange, Affordable Care Act, Obamacare, marketplace compliant plans. This year is chaotic, as most are, but it's even more so because of the news of the extended premium tax credits, extended subsidies, mostly affecting those with higher incomes, but affecting everyone. Many carriers filed two sets of rates as if they were going to be extended, rates as if they were not, and they had to proceed as if they were not. The government is still shut down and has not made a decision. These prices could still come down. Our mindset has been wait and see, but since it's now the 9th of November, we need to start looking at plans. It's probably not going to change much in terms of who's going to be the cheapest plan, regardless of the tax credit or not. This is our Health Sherpa here, which doesn't really work for state exchanges, but it does quote. It will not let you enroll, but it does quote. It's a great catch-all. State exchanges being Penny in Pennsylvania, Get Covered New Jersey, and so on. Start by putting your age in. This is the amount available currently for the lowest qualifying income for a tax credit. Anything less than this is usually going to get you sent to Medicaid. And again, it's a projected income for what you expect to make in 2026. Be careful though, they're starting to clamp down and they're starting to want proof and verification. If you're not anywhere near this income, I advise that you first try Medicaid, as that's where it's going to send you first. Or you have the option to pay full price. Of course, you don't have to take a tax credit. Anybody can pay full price that's able to and has the means. So we're going to continue here. So it's always going to default to its recommended plans. I like to give a gambit. So someone at this income level, silver plans are going to make the most sense in terms of benefits because the deductibles are going to be reduced drastically. It's called cost sharing reductions. If we just look at the silver plans here, this isn't showing Blue Cross. It's showing Highmark. It's not showing Independence Blue Cross. We're going to go over here. We're going to browse for plans since we're in Pennsylvania. You don't have to log in. You can just use this tool to get a sense. If you don't want to mess with your account or anything like that yet, you want to see what the costs are. Sorted by monthly, sorted by silver. Jefferson is basically kicking tail in all service areas that they service. And with the acquisition of Lehigh Health, that's added 30-some hospitals to their network. They've expanded in different counties in the eastern side of the state. Make sure your doctors take it. It works very good at Jefferson doctors and other systems as well, but it's designed for Jefferson. It can still make sense depending on the cost, whereas Blue Cross has been the standard for many. This is a disparaging price difference when you look at these comparisons. We can compare three plans. As it sits, Jefferson took about an 8% increase. Blue Cross is around 22 to 25%, and Ambetter's around 30%. Centene, who owns Ambetter, lost about $6.6 billion, hence really jacked a lot of their prices up. Comparing some of the silver plans. Blue Cross, Independence had to come up with some new plans. There's now a bronze proactive, which, not to toot my own horn, I do remember putting the bug in their product team's ear. You'll be awaiting my bills. I kid. Whereas this would typically have like a $5,000 deductible in that first tier. It's wiped away based on that income. That could be a lot for some folks. Where things might change is if I was to go back and show you 2025, we were at 8 something. That same income, 725. So there's actually more subsidy, but it's all based on silver. Whereas that Blue Cross plan would have cost you 70, went up about $30. And if you had one of these Ambetter plans, they're no longer the lowest cost plans anymore. Jefferson's nudging that out. Not too much of a difference here. The most difference is for the higher income. In 2025, make this person a little older. This would have gotten you some, whereas now, nothing. Now about the most you can make is around $60,000. It depends on your age if you're going to get any help or not. That person there in their 60s is going to get $601, whereas someone younger is not going to get anything. But also the cost for that 60-year-old is at least double the price of that 30-year-old. There's some other markets here. The number you're seeing there is what you're eligible for based on your projected 2026 income put in there, around 40. So this is up in the Allentown area. You can see Jefferson. Your eyes aren't playing tricks on you. Often the gold plans are less than the silver. Why is that? It should be bronze, silver, gold, and platinum if they exist. The reason for that is cost sharing reduction is applied only to silver level plans. When the law first came out, the government was subsidizing those, and as time went on, it became the carrier's responsibility to subsidize those. And once the carriers started having to subsidize those benefits based on that income, they therefore priced the silver plans to be more expensive than gold. Most of the country, that is the case, where gold is less than silver. Silver really makes sense if your income is lower and you're getting those cost sharing reductions. This person here isn't really getting any assistance. You can tell by their out-of-pocket maxes being $10,000 and their deductibles. Going gold there definitely makes perfect sense for them. Right here, Jefferson, look at this, 5 something versus 100. If you live up in this area here, Lehigh providers are going to work because Jefferson owns Lehigh, unless they're an independent doctor and they have control over their contracts. That does happen. You always want to check the network. St. Luke's will not accept their plans, even if they're PPOs. The point being is that if you do go to St. Luke's and you really just can't afford a plan, this one still is a limited network. But even if you went with just a full gold PPO, if you just simply can't afford this, what some have come to the conclusion is buy this as a stop loss to have that what if something major happens. An emergency is going to work. When you have an emergency, you need to go to the closest hospital. If it's a true medical emergency, and I know that can get dicey, but a true medical emergency that requires an emergency room visit, not something that could be done at urgent care, has to go to the emergency room. In that instance, they have to accept you. It may make sense to buy this lower cost plan, and if your doctor doesn't accept it, simply pay to see your doctor. See what the cost of the doctor is. That might make sense than shelling out this kind of money every month. We have to do what we have to do, and that may be a solution, is to go with the less expensive plan that fits the budget, that covers the emergency and the high ticket costs, and pay for those doctors that you want to see out of pocket and just compare those costs, do a little bit of research. That's Pennsylvania in a nutshell here. If we went to enroll, New Jersey's been a little different. You get not only a federal tax credit, but you also get some state tax credit. For those who aren't aware yet, Aetna has decided to completely leave all of the marketplace, all of the Affordable Care Act plans. They're done. They have their reasons, and they're gone again. They started out in the beginning and then left and then came back again a few years ago, and now they're leaving again. Anyone with an Aetna plan on any of the exchanges, it is my understanding that the exchange is going to pick a plan that's most similar and default into that plan. Horizon has gone up quite a bit here compared to AmeriHealth. AmeriHealth and Oscar is actually really competitive in New Jersey. United Healthcare is in the mix. Ambetter, which goes under WellCare in Jersey, still has a presence. What makes Ambetter WellCare unique in Jersey, none of these plans in New Jersey won't allow you to leave the state of New Jersey unless it's an emergency. There is no out-of-network. There is no Blue Card. Even though it's a Blue Cross and it's an EPO and it should work anywhere that accepts Blue Cross, they restrict that access. Ambetter is the only plan that allows you to go to any doctor in the country that takes Ambetter's network. It could be a premium. It's not in all the counties, but that's just something to consider there. It's definitely gotten pricey. Oscar has to pick there. Right now we're in a wait-and-see mode because things do get extended, especially for someone who's higher income. Let's choose someone with a $60,000 income. $65,000 is going to get that person $600.60 credit for 2025, and in 2026 that income is going to get you nothing but a little bit of state subsidy. Someone at this age making $65,000, if the subsidies get extended, that's why I said we're kind of in a wait and see mode. Start to look around, browse, get an idea. The base premiums aren't really going to change all that much. If Oscar and AmeriHealth are the lowest costs here, that nothing's going to change in that in terms of options. Maybe the cost comes down or there's extended tax credits. It could be the difference between buying a bronze and a gold plan. It's good to get an idea of what's available out there and to just make sure your application is in order so you can log in to your Get Covered, to your healthcare.govs. You can use our tool here if you're in a healthcare.gov state. This makes shopping super easy. If I'm looking in Texas like that, makes it super easy to quote, enroll, and buy. State exchanges like Get Covered New Jersey, Penny for Pennsylvania, Virginia's Insurance Marketplace, Georgia Access, Maryland Health Connection. Those are the state exchanges we personally help people with. Most of them other than Maryland are the exact same system. There's Get Covered being the vendor. It's very easy to go in there and just update your application, make sure your income looks right, and tax filing makes sense. If you've gotten married, you need to account for that. If you've adopted or had a baby, got a new job or had a change in income, retired, picked up Social Security, have investment incomes or rentals, make sure that the application is as close can be. That way, at least that part is done. And if you settle on a plan now, or at least a couple plans, and just kind of wait and see what the government proposes, because there's lots of back and forth, it could change things. If they extend these subsidies again, it could mean help for a lot of people who are currently now going to lose their assistance at the end of the year. Stay tuned. We'll keep giving you updates, but this was our Pennsylvania, New Jersey outlier, the state of the markets. Do it for me insurance.com and take care.